Good afternoon, dear patients. Today we will discuss a case. Mycoplasma genitalium in a man. Indeed, this is a very serious type of infection about which most medical doctors have absolutely no misconceptions, especially regarding the specific details of how to treat it effectively. Recently, a man came to us for help who had already visited several different doctors. They had simply prescribed him some standard pills, but they did not work. Such pills as, for example, Sumamed, Vipprofen, and Moxifloxacin. But in general, the same Mycoplasma genitalium kept being detected even though he hadn't had any sexual contacts for a long time. Accordingly, during the examination, he was found to have the very same discharge that you can see in the picture. So a smear for flora was taken, a culture for flora was done, and PCR was performed, specifically including Mycoplasma genitalium, which confirmed firstly the presence of inflammation, secondly the absence of other flora, meaning for example staphylococcus and so on, in pathological concentrations, and finally the presence of Mycoplasma genitalium. Indeed, lately among our doctors, venereologists who have absolutely no knowledge of the urethra, its structure and so on, have often in fact become what I call pill doctors. That is, for them, the main thing is to prescribe some pills, and sometimes even without examining the patient, and even well-known professors are guilty of this. It's often enough basically just to let the patient go. So, a number of them, or rather many of them, do not want to admit that with pills alone, these days, it is quite difficult to cure almost all sexually transmitted infections, and in some cases it's impossible. Especially with the treatment courses that, in fact, they are offering. Therefore, accordingly, with such patients, particularly those with Mycoplasma genitalium, they are surprised to find out that, as it turns out, the pills don't work in those cases. Well, in fact, the pills have not been working for a long time already. And this is not only the case with Mycoplasma genitalium, but also with many other infections. And these patients simply leave them with various complications and persistent sexually transmitted infections while they think everything is fine thanks to their little routine. Well, accordingly, that's not how things have been for quite a while now. Such patients often end up coming to me or my colleagues, and basically we have to treat them properly, not just with pills after these so-called miracle pill doctors. There are also ointment doctors and doctors, suppository doctors and so on, but that's a topic for another day. So what do such patients need? Such patients need proper standard treatment, which has actually been established for quite some time. But in fact, things like tampons and urethral dilations have been used in medical practice for a reason. And so with the advent of antibiotics, there appeared so-called pill doctors who simply prescribe pills and essentially step aside from the patient. That is, they treat the disease, not the patient themselves. They try to cure it this way. Even if, according to my observations, they do succeed. But that is far from always the case, and the patient often ends up developing prostatitis. After these pills, periurethral stones in the prostate and so on can develop. In general, there are various problems that patients come to me with, but these so-called magic pill doctors usually don't see them at all. That's why nothing magical was prescribed to this patient. Nothing magical at all. A standard course of treatment was prescribed, including Longidaza, enzymes, immune medications, irrigations, and even the same antibiotics. As a result, after 2 weeks of treatment, the patient was given a break. 3 weeks after the end of treatment, standard tests were taken. PCR, a flora smear, and leukocyte levels had almost normalized. Accordingly, Mycoplasma genitalium was treated with T-cycline. This shows that the era of pill pushers, doctors who don't want to properly treat patients and just try to brush them off with some pills, is fortunately coming to an end. And they have already started to feel this, and at conferences they are beginning to admit that yes, pills are not always effective, even among the so-called pill pusher doctors. So overall, this is a positive development. Doctors are starting to think about what they should do, how they should do it, and how to treat patients remotely. Therefore, when doctors recommend not reading the internet, but instead getting treatment from a competent physician.